I'm Paul Auwaerter, and I'm an infectious diseases physician from the Johns Hopkins University School of Medicine in Baltimore, and have been working on COVID-19 and therapeutics since the start of the pandemic. If you happen to be ill with a respiratory illness or flu-like illness, and you've been tested and waiting for those results, or maybe you know the results and it seems you have the coronavirus infection and you're at home, many people are understandably anxious. They want to do something to get them feeling better faster and to stave off serious illness. There's no need to panic. Many people just have mild to moderate illness, and you'll do well at home. And the reality is there are really no medications that I can tell you from what I know from the totality of clinical trials and medical information to date that will help you at this stage by taking some kind of pill. Over-medicating you will do you no favors and only lighten your pocketbook. So it's best to stay home, and like with any flu-like illness, stay hydrated, watch and make sure that you're not becoming more ill or dehydrated. If you're becoming more short of breath, then by all means, seek more medical care. Keep yourself from others. You don't want to infect anyone else if possible. This is a highly transmissible virus. Wear a mask to help prevent you from infecting any others. If you do have a fever that's making you uncomfortable, you can take an antipyretic, and that's safe to do, although I usually tell people that letting the fever run is probably helpful and making your body less hospitable for the virus to replicate itself. Unfortunately, the bad news is here we are now 15 months into the pandemic, and I can tell you there are no oral medications or treatments that we know of that can help you at home. Now, there's been a lot of promise because of test tube studies that certain medications might work. However, the reality is numerous clinical trials have failed for all of these medications to date. The ones that I'm going to mention are azithromycin, an antibiotic, hydroxychloroquine, sometimes known as Plaquenil, studies combining hydroxychloroquine and azithromycin, ivermectin, colchicine, favipiravir, a medicine used for influenza. None of these have really panned out or worked. There is an inhaled steroid, budesonide, that is usually used for asthma, that in some small studies may help slow progression of illness. A medicine which does work for severe COVID-19 is dexamethasone. Dexamethasone is an oral steroid. It's also available in intravenous form if you're in the hospital. And this drug is extremely potent, and in a large trial called the recovery trial, surprisingly helped patients, especially if they were severe enough in their illness to require mechanical ventilation or supplemental oxygen. It did decrease mortality and has been adopted as standard use in many hospitals across the world for people with severe COVID-19. But here's the important point. In that large recovery trial, people who did not require oxygen had worse outcomes if they used dexamethasone. So taking dexamethasone too early is bad news. antibody-based therapies such as convalescent plasma have issued a lot of passionate debate about the role of whether it's helpful. There have been many, many studies about taking plasma from patients who have recovered from COVID-19 and then infusing it in people that are ill. Many of the studies have turned out to be negative, and part of that issue, I think, is because lots of the plasma taken from patients may not have sufficient amounts of antibodies. Studies that have exclusively used high titer convalescent plasma can impact illness if used early in the illness, when there's still much virus that's being made in the first few days of illness, for example, days 2, 3, 4, 5, perhaps. A study from Argentina looked at elderly patients over 65 who had only been ill for no more than 3 days and found that if they received a high titer unit of plasma, they had reduced chances of progression to severe illness requiring oxygen and hospitalization. So although there have been many studies that have suggested it doesn't have a role, many of these have used the plasma much later, such as day 9, for example, which probably is just too late for plasma to have any role. Antiviral therapies include antibody-based therapies. However, the one antiviral medication that has proven to be effective in one well-done trial has been the drug called Remdesivir. This was originally developed for hepatitis C and used in Ebola virus trials, but turns out to have a very good activity against coronaviruses. The trial called Act 1 was performed early in the pandemic, and its primary endpoint found that patients who were ill enough to be hospitalized, if they received remdesivir, on average, their duration of illness was less than 5 days. This improvement also included some trend towards decreased mortality, but that study really didn't have enough people in it to show a mortality benefit. So the drug is mostly used for people who have a oxygen saturation of less than 94% and require oxygen. And even more contemporaneous studies done later in the pandemic still show decreased duration of symptoms and length of stay if the drug is used. It doesn't have much effect if the drug is started late into illness, such as someone that's ill enough to be in the intensive care unit. Remdesivir is often used in combination with the anti-inflammatory corticosteroid dexamethasone or other anti-inflammatory corticosteroids such as methylprednisolone or hydrocortisone, studies of which also suggested improvement in patients who are more severely ill in the hospital, requiring oxygen, and in the later stages of illness.